Hey, future medics. Tina here, your medic mentor. And today we're continuing with medication that has become a big player in trauma care, tranexamic acid. Brand name is cyclocapron, but you're going to hear it mostly called TXA because it's much easier. TXA is an antifibrinolytic. Stay with me. It's okay. It's okay. Whenever you are healing in your body, there is a fibrin layer, fibrinolytic, fibrin layer, like lattice work, like mesh, that is laid down to be the lattice work for things to close. Okay? So clots are made of fibrin. You're with me. Plasmin is an enzyme in your body that breaks down fibrin. So it will break down any clots that are inside of your body. Plasminogen turns into plasmin, which goes and seeks out those fibrin layers and fibrin clots and will break them down. But when we have a very bad trauma patient who's bleeding internally and we can't put any pressure on it to stop the bleeding, or they're just exsanguinating, we need them to keep all the clots they've managed to make, right? So TXA does not allow plasminogen to turn into plasmin, which can then go and break down those clots. So it doesn't directly make clots and stop the bleeding, but it stops our body from being able to break down the clots we have been able to make. In EMS, we give TXA with either internal or external bleeding, either or, but especially with signs of hemorrhagic shock. Now, ideal time is to give this medication within the first hour of injury because it is actually contraindicated 3 hours past injury. Once we give this, onset is immediate and it lasts for several hours. The dose is 1 gram and it's going to be IV or IO over 10 minutes. Do not slam this drug, okay? This needs to be titrated in over some time. You'll often see that 1 gram mixed in 100 milliliter normal saline and dripped into your IV over time. But if your local protocols have you giving it over 2 to 5 minutes, make sure you are doing a slow IV push because if you slam this medication, it can cause hypotension, which is kind of a thing we were working against. So we don't want to see that. Okay, so side effects. We already talked about hypotension. Do not push this quickly. You'll see hypotension. You're going to be working against yourself. You're already doing enough work here. Let's not do that. Other ones that you might see could be nausea and vomiting. The contraindications for this one we talked about earlier. If it has been more than 3 hours since the onset of this injury, do not give this medication. It has a sweet spot of onset to 3 hours, and it works very, very well. But past that 3 hour mark, negative effects. So that's a hard contraindication there. Also, anyone with a known problem with DVTs or PEs or any kind of clotting disorder that makes them hypercoagulable. So they are prone to blood clots. We don't want to give this to them because we don't want to endanger the rest of their lives, okay? If you have somebody who has a clotting disorder, which makes it hard for them to form clots, you should give this because they could use the extra help. But if someone tells you they have a clotting disorder, ask what kind, like what does it do? If it makes it so they can't break down clots already, they cannot have this, okay? So TXA, incredibly helpful medication, but it's important for you to remember timing is important, and also it does not form new clots, but it keeps your body from breaking down the ones that you've already made. You're doing great soaring through these drug cards. I'll see you for the next one.